Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
Alrighty. Joyce, you mentioned giving the pre-med sub-Q when you can't give IV. My understanding is that the absorption of opioids are unpredictable given sub-Q. Do you find healthy animals are sufficiently pre-medicated on, we actually use hydromorphone and Midaz, but methadone is fine. Most of my patients are, absolutely. They will show the same signs as if I gave it IV. They do that little hydro pant. They'll start to lay down and relax. So absolutely, I see still the effects. So haven't seen any patients not have be affected by that given sub-Q. Does the butorphanol not reduce the effectiveness of the primary opioid? In some cases it can, but remember, butorphanol only lasts about an hour. So it's gone well before the hydro is gone. Hydro is there for a good 6 to 8 hours. So sometimes we'll repeat the hydro injection before they go home, but typically we don't need to. They're very comfortable, primarily because of the regional nerve blocks. But because of the timing, that butorphanol wears off way before the hydromorphone. So we don't have that conflict. Alrighty, question from Erica. Any tips on training the veterinarian to create and use the dental team? Good question. And again, that's kind of in the same thread with those older school veterinarians and technicians. And dentistry absolutely is a team sport. That's how we teach. That's what we encourage and recommend. Only because it helps tremendously with efficiency and moving that case forward to keep our anesthesia time as short as possible and devote the majority of that anesthesia time to the oral surgical part of that total procedure. So we don't have our oral surgeons trying to do things quickly. I assist from beginning, middle, and Dr. Beckman and I are working toward that same goal. We each have our own skill set, but we're working together to move that patient forward and be as efficient as possible. And it takes the pressure off to have a team in there, and it doesn't take a huge team. In fact, we want that team rotating through that dental suite very, very often so that you're immersed in dentistry and kind of pick up all of these techniques that I'm going to be talking about in the next 4 weeks here that will eventually help with workflow and shorten those times for those patients. But we've really got to, kind of, again, educate the staff and those of you that are passionate about dentistry and, want to be that dental department. That's where you can kind of shine and just say, hey, we're going to put this together and really provide a high standard of care for our dental patients. But it really takes a team. Absolutely. All right, question from Tabby. In a clinic where they want to see how much we can cram into each minute, what is the average time it takes from induction to finished diagnostic assessment and cleaning? Excellent question. And we recommend that first portion, and again, doesn't include the cleaning necessarily. The cleaning is going to happen at some point during that procedure, but the first first steps that need to happen are induction, dental x-rays, putting the chart together with radiographic and gross findings, which is done as a team. Dr. Beckman's looking at the x-rays. I'm in the mouth doing a very quick cursory cleaning, looking for things that he can't see on x-ray, like oral masses, discolored teeth, periodontal pockets, all kinds of things that I'm going to find on that gross exam. So there's two of us putting that dental chart together. And once that dental chart is completed, taking that to my computer, making an estimate, and calling that owner for permission. That all has to happen, and this is a goal, so this is something that you would track. I recommend people get a stopwatch, track yourselves to improve over time. This is not something that I did when I first started with Dr. Beckman. It took me a good 6 months to a year to get consistent in reaching this goal. And your goal from induction to x-rays, dental chart to estimate, and client permission, about 15 minutes. And we hit that goal pretty consistently. There are some cases that have a lot more pathology as far as perio goes that we're going to try and save teeth. Sometimes that'll slow things down a little bit, but in most cases, we're hitting that goal. Does not include the cleaning. The cleaning will take place. That's more or less incidental. That's going to happen, but we'll squeeze that in either at the beginning or at the end, depending on what we need to do with this patient. But we're going to get that client permission right at the beginning, and that gives us kind of some flexibility how we're going to complete this case. For instance, if your veterinarian/oral surgeon is available right then they're going to get in the chair and do what they need to do so they can move on to the next thing. If your veterinarian/oral surgeon is not available, finishing up a spay, finishing up a phone call, finishing up an exam, then you are going to do everything you can as a technician to move that case forward. You're going to place the nerve blocks, you're going to clean, you're going to note any maybe gross pathology, maybe that was missed on the quickie, exam there. But you can clean those teeth until your oral surgeon is available, and then they will jump in the chair, complete what they need to do, and then you can finish up with the cleaning at the end. Rather than clean the teeth, then get a diagnosis, and then call the owner, we tend to be sitting around kind of waiting. And so if we get that initial portion all banged out, then we have some flexibility how we can complete that case, especially in a busy general practice where I know that a lot of different things are going on at the same time. So we want to be able to be as efficient as possible. Jennifer writes, there was a mention that you don't use propofol in patients with chicken allergy. Do you have any additional information on this? I don't. That was actually one particular patient that the owners were told by their primary vet to avoid propofol. And so that's when we do an alternative. And our alternative currently is alfaxalin, which I didn't mention in that first session. Alfaxalin is relatively new, and it's new to our practice anyway. So that's a good alternative for those patients. But 99.9% of the patients that we're inducing are being induced with propofol. Susan Ann writes, I noticed that you do 3-month and 6-month cleanings. Do you take full mouth rads at every cleaning? Really good question. And if we're seeing them at the 3-month mark, no, there's not going to be very much change there. And that's typically when we've done maybe a bone graft that we want to monitor and take an x-ray of and make sure that that bone graft is successful. Our 6-month, 8-month, 10-month, and yearly prophies, we are doing full mouth radiographs. And I have in my practice management software for those folks that come back when they're supposed to, those repeat visits, that we are doing full mouth radiographs. I do have a set that kind of gives them a bit of a discount as opposed to that first visit when we saw them. I want to make it as affordable as possible so that those folks will come back. So I do give those repeat folks a break on completing full assessment at the 6-month mark for sure.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.